Third part of our series on the struggles of the National Health Insurance Scheme, we take you to the Bono East region, where some subscribers of the scheme are lamenting how they are compelled to pay for almost every service rendered them. The situation, the subscribers say, has dashed their hopes in the scheme many thought would help alleviate their suffering. Anas Abid has today's feature from the Bono East region.
It's really sad to see that the policy has ended up this way. Because I can't remember those days. We used even to criticize the policy in a way that, when people go for labor, they don't pay anything. And somewhere along the line, we're even criticizing that there will be high dependency ratio because of that. So the poor were really benefiting at the initial stage of it. But today, it is no more like that. I can say most poor people die accidentally because they cannot patronize certain things.
Naomi Dia was a subscriber of the NHIS policy before she decided to opt out. She recounts how some hospital administrators in the Pro East district keyed in drugs covered by the scheme, only for her to be told to buy the medicine from outside the facility.
I experienced something like that in precisely Yeji, but I wouldn't mention the name of the hospital. They queue in, all right, but the prescription was given to me at the store to go out and buy the drug. So in this way, are you not duping the state? It goes back into individual pockets.
This gentleman here, who asked to be interviewed on anonymity, says the scheme is worse off today as subscribers of the NHIS are made to pay for almost every service provided by the various health facilities.
Oh, I think it's getting bad because the last time I visited the hospital, they asked me to even pay for the card they gave me, because it was my first time going to that hospital, and they asked me to pay for the card, and which I think that one is free always. But I was shocked when they asked me to pay for the card before even seeing the doctor. So I think it's getting worse.
Mariam Alassan's kid brother is currently on admission at one of the private hospitals in Tichiman. For 3 to 4 days, Mariam has been made to cough out nearly 1,600 cedis just to buy medicines for her brother who is currently on admission.
In my own experience now, Mahu Sesiano, there's 3-4 days.
For the past 4 days, I have a brother currently on admission, and insurance cannot cover a lab of even 15 Ghana cedis.
So far, 4 days, almost 6 million.
So far, we've spent almost 1,600 Ghana cedis. They'll ask you to go for medications, and when you get to the pharmacy, they'll redirect you to the cashier, and if you don't pay, they won't attend to you.
The situation, according to Mariam, is leading to the death of many, particularly the poor, who cannot afford to pay for quality health care.
Today, if you go to the hospital and you have no money on you, that means you are going back home to die.
But what could be the major contributing factors to the recent underperformance of the NHIS? Some are of the view that corruption on the part of the various health facilities is largely to blame.
I think it's the health workers. That's what I will say, because the system is being corrupt. Everybody, when you get some opportunity, you want to use that opportunity to be a billionaire here in Ghana. So everybody should be blamed. That's what I think.
I normally tell people that all Ghanaians are potential armed robbers. We are bound to dupe the state at any point in time. So I think our hospital administrators, the PROs of the policy, and the some doctors in the state, they have rendered the policy irrelevant, and the policy has failed due to those people's behavior.
On the back of this, the National Health Insurance Authority has expressed worry at the rate some patients are being made to pay for drugs and services the scheme covers. Spokesperson for the National Health Insurance Authority, Barry Masapon, is urging patients who are charged for services and drugs listed under the scheme to seek refund once they can show their receipts. He's been speaking with Features editor Richard Kojonyako.
The medicines that are covered under NHIS, as well as the services, are being paid by NHIS.
And hospitals are saying that we don't have. I mean, so you have to go outside and buy.
No, it's a different situation when they say we don't have the medicine, and so we want to prescribe for you to go out and buy.
That medicine is covered by the NHIS.
Covered. If it's covered and they prescribe it for you, just take your card and the prescription. Go to any pharmacy that we work with, because we also deal with pharmacies and chemical shops. They can give you the medicine without taking money from you. So now the question begs for answer. Why is it that when a member takes his or her card and a prescription form to a pharmacy, they give them the medicine without taking money from them? But when the hospitals give them the same medicines, they take money from them for the medicine. It means NHIS indeed is paying for the medicines, but somebody is trying to look sharp. So to help us also deal with this thing and get your money back for you, you need to insist on receipt. Never pay any money anywhere without insisting on receipt, as far as NHIS services is concerned. Because it is only at the back of you receiving or taking receipts that we will be able to verify whether what you paid for is actually supposed to be paid for, or it's rather paid by NHIS, and so nobody's supposed to take your money for that.